Hometown Radio, KGAF, about 7:45 here on a Thursday morning. Very happy to have a guest who's dropped by the studio this morning, Brian Roland, the CEO at Muenster Memorial Hospital. Nice seg from promoting Muenster to talking about Muenster Memorial Hospital. Brian, welcome.
Hey, good morning. Good morning to you. Good morning, everybody out there. I'm actually here to talk about National Rural Health Day.
Which is today.
It is today, yes, third Thursday of every November. And but before I do that, I do want to wish everybody a happy and safe Thanksgiving. We have a lot of stuff to be thankful for, especially not being a 4-pound dog sunbathing in Venice, California when FedEx drives by.
Yes.
If you were listening earlier this morning, you know what I'm talking about there.
Crazy.
You know, and I do want to wish our sports teams, our local sports teams this weekend, safe travels, safe play, and good luck. But what I'm here to talk about is it's National Rural Health Day. And I think a lot of times we can talk about national rural health or rural health. I could talk for 2 hours. But really, what is National Rural Health Day and what are we looking at? And it's not just the hospital. It's not just the doctors. It's the nurses in the schools. It's the pharmacies. It's all of these other things and all of the things that they do to promote healthcare in our organizations. And there's numbers out there that I could throw out that talk about, you know, the importance of this and the importance of that. I think a couple of really interesting things that people may not understand is there are 57 million Americans that utilize what is called rural health. Now that, oddly enough, is only 19% of our population. So if you're good at math, you know what those numbers look like. But those 57 million people cover 75% of our landmass. So they're really, really spread out. And so you're dealing with a lot more landmass and the pieces of the puzzle that you have to figure out how do we take care of these folks. And looking at what you deal with rural health, your people are usually older, a little sicker. And so you've got to make the determination, especially now, the next 4 to 6 years in healthcare are going to be really, really interesting. If we turn back the clock and look at the Affordable Care Act when they first started talking about that and how great that was supposed to be for you and I and how our cost of insurance wasn't going to go up and it wasn't going to cost us any more money. And that was a great story. And there are some great things that came out of that. But now you look at it and see what we're dealing with from the healthcare side. Now we're talking about Medicare for all, healthcare for all, universal healthcare. What does that really mean for you sitting on the farm in rural Cook County as we're looking at healthcare? And those are the things we have to look at. So how do we, again, and I've talked about this for many years on the radio here, how we manage today as we prepare for tomorrow. And really, a lot of it boils down to is what do you want out of your healthcare? What do you want out of healthcare in Cook County, in Muenster, in the Muenster Hospital District, in rural healthcare? You know, we sit here and we talk about the hospital. We expand that out. We have agencies that we deal with, State Office of Rural Health, that does a lot of stuff for us for grants, training, education, our tertiary partners that help us with staff and training, and we just have to continue to be thankful to have all of that because we don't really know 3 years, 5 years, 10 years down the road what is rural healthcare going to look like. I wish I had a crystal ball, you know, and I love quotes, and so one of my quotes is your purpose in life is to find, your purpose in life is to find your purpose and give your whole heart and soul to it. And that's really what rural healthcare is. You know, the benefit we have, and I'm going to brag on Muenster, is our quality of care is second to none. The nursing staff, the therapy staff, the dietary staff that we have at Muenster, that's what brings people to our hospital. And we have to figure out how do we continue to make that happen. There are challenges every day. I think since the last time you and I have talked here, There's at least 10 hospitals, rural, that have closed or filed bankruptcy. And while we don't want to think about the bad stuff on National Rural Health Day, that's a part of it.
Mm-hmm.
You know, and we've got to figure out how do we praise what we have, continue to grow, and manage so we have healthcare tomorrow. And it's not just Muenster. It's all of these. You know, you look at, and this is an interesting thing. You listen to where all these football teams are from that our guys play,
Mm-hmm.
and the girls play in basketball. Most of those towns have small rural hospitals. And it's really, really exciting. It's an exciting time in healthcare. I look back, and you can probably do this too. I've been in healthcare for 28 years. And I look back on what it was like when I first got into healthcare, and it has changed immensely. And what's going to happen tomorrow, we don't know. But the game plan is rural healthcare is here for you. We've got to continue to make it happen. You know, I can sit here and I can talk about the numbers. I can talk about, you know, Medicare reimbursement, Medicare Advantage, and the slap that we get from them. But really, this is to praise the nurses, the people that work hard, the people that deal with the challenges that we face. And again, I want to stress the fact it's not just the hospital. It's not just the doctors. You know, we have nurses in our rural schools that take care of healthcare needs, and this is their day. Mm-hmm. And so if you see somebody today, and I think today is also National Cousins Day, you know, if you see a healthcare worker, thank them, especially rural, because, you know, we deal with unique challenges that a lot of places don't. You know, it's not like going into a factory and putting something together, or building a car or whatever. Healthcare is a unique animal, and rural healthcare outside a large metropolitan area builds on those challenges, and we keep moving forward.
And you mentioned this day is for those that provide, whether it be the nurses or whatever. And they do this, I might say, despite these challenges that you guys face.
And that is it.
They overcome the challenges.
They do. And it's really, you know, and my mother used to say to me when she taught in certain areas that it was a mission. And I really think for a lot of these people, it's more than just a job. And if that's all you're looking for is a job, mm-hmm. rural healthcare is not the place to be, because it's not just going in and punching a clock at 8 o'clock and leaving at 4 o'clock. There is a lot more involved. Every day there's something going on. And whether it's dealing with an older facility like we have in those challenges, some of the challenges that we come up with, the healthcare related things with the health of our folks. You know, how do we ensure that we keep up with the time? You know, that's the interesting thing with rural healthcare. And I think a lot of times people don't understand this is, and we've just gone through a couple of CMS surveys. We follow the same exact regulations as the Parkland hospitals in the UT Southwesterns, mm-hmm. and those big organizations that have multitudes of people that do certain things, yet the expectation is Muenster or these other small rural facilities have to follow those same guidelines. Our generators can't run any different, and our medicines can't be any more, you know, laid out a certain way, and our lights have to be a certain wattage, and we still have to do all of that same stuff.
Right.
And you're doing it where you're wearing multiple hats. You know, something breaks, and I don't, you know, we don't technically have an HVAC guy.
Right.
Or this guy or that guy, like a lot of these larger facilities. You got to step up with the duct tape and baling wire sometimes. You know, and so it really is. It's a calling, because where rural healthcare at one time may have been a job, and the cool part for us and for me, and I know that's probably the wrong word to use, is we have a lot of students now that come through our organization, nursing students, therapy students, and it's rural healthcare is a really good place. Excuse me, for them to see healthcare at its best, because you're not just working one thing or seeing one thing. If you're a nurse at Muenster Memorial Hospital, you may be taking care of a swing bed patient, an acute patient, a wound care patient, an ER patient. It could be somebody that's 65 years old or 5 years old. And these students get to come through, and unlike a large facility that might just do med surg, they see every piece of that. Our clinic is the same way. You know, our nurse practitioners and our providers might see somebody that is 65 years old and then 5 years old. And our nurses in the clinic, our physical therapists, same thing. You might have a stroke victim, or you might have this. So it really makes it an interesting challenge.
Well, it's got to be, and we know that, and the fact is, you guys do what the big guys do, and the unfair part, in my view, is you don't get paid like the big guys get paid.
So that's correct. Yes, yes, our facilities don't, but our staff are very appreciated. I mean, whether it's appreciated by our board, the administrative staff at our hospital, our patients, and that's probably sometimes where they do get the better accolades than some of those larger facilities, because everybody knows everybody.
Right.
Now, that's good and bad sometimes, but they know who's taking care of their mother or their brother or their sister. And sometimes that quality makes it so much better.
It's like I always said, it's always better to be a name than a number, right?
That is correct. That is definitely correct.
And that's what we have here. All right, Brian, thanks so much. Again, today, National Rural Health Day. So if you're out and about at your local rural hospital or school or whatever, thank the nurses and workers that make it all happen for you. Brian, thanks a lot, and we'll visit again down the road, my friend.
Sounds good. Thanks
all
a lot.
right, he is Brian Roland, CEO of Muenster Memorial Hospital on Hometown Radio KGAF.